need to assess the client, especially for the history of bowel movement, the bowel sound using our stethoscope, and especially the presence of hemorrhoids. We need to assess for discomfort or the sphincter control, especially that may cause sometimes discomfort, and sometimes if the patient has any pain or discomfort in the abdomen. We need also to assess the experiences or the knowledge of the patient regarding the administration and the importance of enema. And we need to assess their mobility to help us doing the procedure. To prepare and gather our materials for our administration of enema, and make sure especially that we already used or done our hand washing using our aseptic technique. Good morning, ma'am. I'm Oberio Gallardo, and I am your student nurse from Central Philippine Adventist College. And I am here this morning para mag-administer ng aton nga enema. So, ma'am, may I know your name, please?
Hi.
May I check your ID, ma'am? So, ma'am, before we will administer our enema, I will explain the procedure to you. So, first, I have already done hand washing, and we will ensure that we will ma-provide kita, ma'am, ang ating privacy. So, we will close the privacy curtain. And, ma'am, before I would administer the procedure, i-check na ito ma'am ang physician's order, ma'am. Kung ano nga klase ang enema, ang aton nga himuon. So remember also to check the standard precaution depending on the institution. So, ma'am, I will just gather my equipment, okay? We will use tactile solution to help with the secretion if it is ordered by the physician. I-assist ko, ma'am, sa pag-position ko tanikod, ma'am. Mabutang kita, ma'am, kang absorbent pad. So it is very important, absorbent pad below sa buttocks of the patient. So ma'am, assist ka, ma'am, sa pagdalikod, ma'am. Kaya mo man, ma'am. Butang ka na yung absorbent pad, ma'am.
Kaya.
Para hindi ka mabasa. So dalikod kita, ma'am. So ma'am, as part of our privacy, i-cover na to na imong other area aside from the anal area, ma'am. Remember, don't forget to explain the procedure to the client. Ma'am, excuse me, before kita mag-umpisa, ma'am, I would explain the procedure sa imo. So, ang enema, ma'am, is very important para makabulig ka nimo sa pagwa kang imo nga bowel evacuation, ma'am. Para makapamuson ikaw because of sa imo nga constipation. This time, we will prepare our enema and make sure that we will use warm water. So, we will infuse it with, depending on the prescription of the doctor, it may be 250 ml or 1 liter. Make sure that the water is not cold or not too warm because it would affect the client, especially the procedure. So we will prime the tubing to remove any air. So we will open, control, and siya as if that there is a solution inside. So after we have primed it, make sure that we have a commode, a basin, or make sure that the CR is free for the patient's use after the administration of our enema. So, our first administer is the pre-packed disposable enema. We need to remove the cap of the enema and make sure to lubricate it using a lubrication. It would avoid any discomfort as we insert it to the buttocks of the client. So, we need to go to the client. Ma'am. So, make sure that the buttocks or the anal part of the area, the patient is exposed. And we need to assess the client and ask the client to deep breathe, to have a deep breath as we insert the tip of the enema. So, now, what we will do is, we will insert it at least 3 to 4 inches to the anus of the client. Ma'am, pwede ko ka ginhawa dado ma'am, pumagi sa mga sa. Ma-insert kita ma'am ha. For the pre-packed enema, we need to squeeze the bottle at least 250 ml to administer it on the colon of the client. So we will squeeze this until it is all done. For the standard enema procedure, we need to do the same procedure. So we need to remove the cap, lubricate the tip of the enema, and wear the botox, and we will once again insert it to 3 to 4 inches. Ma'am, deep breath kita ma'am ha. While we will holding it, we need to raise the container at least 12 to 18 inches above the client's buttocks or hips. So we need to adjust this one. So usually in the healthcare, we are having pole, IV pole. We need to put it in a high IV pole. So we need to check if the solution is running not too slow or not too fast. If it is too slow, we need to raise it higher. And if it is too fast, we need to raise it lower. And make sure that we have opened the control so that the solution will go to the colon of the client. And we need to check if there is leakage in the client. So after the procedure is done, we need to assess and tell the client that we are done. Ma'am, okay na ma'am, kuha ko na ito ma'am ha. And we will use toilet paper. Assess the client in a comfortable position and cover the client. Our material in the proper disposable area, and we need to educate the client especially about the distension. Ma'am, ay allow lang natin nga magstay siya ma'am ha, at least 5 to 10 minutes kag updan ikaw karon sa CR. Ma'am, natural lang gid nga mag-distend ang aton tiyan because sa solution ni aton gimbutang. Okay ma'am? So remember that after that we remove, we need to cover and provide the patient's dignity and privacy, and we need to gently remove the enema. After that one, we will assess the client going to the CR, especially if they are able to ambulate. After that the patient is done with the 5 to 10 minutes, we will assess the client going to the CR, and we will provide aftercare and assess the patient, the client, in a comfortable position, and especially we will don't forget to document the care that we have done to the client. Ma'am, let's go to the CR. Situation, we will ask the patient if the discomfort due to the constipation is relieved, and we will assess the consistency, the amount, and the characteristics of the stools of the patient passed by the patient.